Okay. So we are doing the ketogenic diet versus the CDC guidelines. So our research question is between the ketogenic diet and the recommendations for fat loss of the CDC guidelines, which is more effective for weight loss? So the ketogenic diet in itself is a controversial diet. A lot of people face impairments when they start the diet and a lot of issues. The CDC guidelines are there as a comparison for the two and which one would be better for fat loss, which diet. A popular social media reference was the bodybuilding.com website. It was the most popular website in that self-proclaimed, and it's pro-ketogenic. A lot of articles were on the ketogenic diet. There's a lot of tips, a lot of tricks, starter packs, and advice from health professionals, as they said. And this website was built for guidance on building muscle.
So the ketogenic diet pros has to do with the fact that it controls hunger, and there's also glucose control because the blood sugar is not in the bloodstream from regular carbohydrates. And there's also insulin resistance, and insulin is spiked. That's what prevents fat loss, and it also just improves your overall metabolism over time.
So the cons of the ketogenic diet are that for people with kidney disease, it can worsen the condition. And one of the issues is that it's highly individualized and restrictive. And the main criticism is that people tend to eat poor quality fats and excessive protein from processed foods. And some of the adverse effects include hyperlipidemia, impaired neutrophil function, optic neuropathy, osteoporosis, and protein deficiency. And some studies have shown that there are impairments in higher order cell processing.
So the pros of the CDC guidelines is that it encourages people to eat a balanced diet. They leave room for you to enjoy your foods that you would regularly enjoy. It helps to provide simple guidelines for everyday people to follow to help prevent illnesses and diseases that are caused by poor diet by encouraging you to eat a wide variety of foods. The CDC guidelines have also influenced school lunches over the last few years, and they have cut out a lot of the sugary, fried, and salty foods from school lunches, which has greatly decreased the amount of childhood obesity recently. Low-fat diets, which is part of the CDC guidelines, help to reduce waistlines, which over time reduce glucose levels because people who carry most of their weight in their stomach tend to have higher glucose levels.
So some of the cons of the CDC guidelines, the CDC guidelines is mostly a low-fat diet, low-fat, it's guidance on low-fat meals, and diabetics, specifically type 2 diabetics, do not benefit from low-fat diets because they need the fat and the different benefits to it. It is actually proven that a low-carb diet is better for them. Also, low sugar is where the focus should be. So there has been experts saying that low-fat diets have been promoted, but really there should be an emphasis on sugar. And then lastly, there's no help with the temptation issue. So low fat is very addictive, and a lot of people won't have help with that if they do the CDC guidelines, because like the title says, it's just guidelines. It's not a strict diet. There's no real step-by-step that people have. Yeah.
So in terms of being more effective for fat loss, we found that the ketogenic diet is more effective than following the CDC guidelines. However, I would add that the adherence to the ketogenic diet is difficult, which is also why it's hard to find studies for the long-term effects of it. So further research is needed.
And then we have our references. And that's it.
Okay.
We'll stop
Thank
recording.